Evolving as an epidemic disease at a perturbing rate, diabetes mellitus is a matter of global health concern, agitating immediate call for action. It is a lifelong, non-communicable metabolic disorder that, according to the International Diabetes Federation, affects an approximate of 400 million people worldwide, or 1 out of 11, and it is among the top causes of fatalities each year. Although various researches have been made in efforts to completely understand the issue and develop a medication, the medical society has yet to discover and produce a cure to eradicate diabetes. Therefore, treatment for such disease would continue for the entirety of the patient's lives.
Now, moving on to formally introduce metformin. Regarded as one of the essential medicines in a health system as listed by the World Health Organization, metformin is the primary and most prescribed medication for diabetes. It is a derivative of Galega officinalis, or more commonly known as French lilac, which is rich in galligine, a blood glucose lowering but toxic substance. Metformin also belongs to an anti-diabetic class of drugs called biguanides, which inhibit hepatic gluconeogenesis and increase the body's insulin sensitivity. Initially, there were three main biguanides, including fenformin and buformin, but only metformin has continued to be developed and commercialized due to its best available combination of safety, efficacy, and tolerability.
On the other hand, Costus igneus or the insulin plant is indigenous, abundant, and is already popular for its anti-diabetic properties in India. Meanwhile, its availability in the Philippines is limited to plantations and farms, which are results of export from India for the same medical purpose. Although no clinical trials has yet to be conducted for the plant, previous experiments on diabetes-induced rats prove its anti-diabetic property. However, despite being proven to possess pharmacological activities, medical practitioners still don't prescribe the use of herbal medicines since the intake of herbal and chemical medicines altogether is still not advisable.
Significance of the study. First, it produces a study regarding insulin plant in a local context. Second, it provides an understanding of current knowledge of the primary commercialized medication and its beneficial counterpart in treating diabetes. Lastly, it is beneficial to other students or researchers through giving additional knowledge about how efficient the insulin plant may be in treating diabetes.
Moving on to the objectives of the study. Our first objective is to study the advantages and disadvantages of both insulin plant and metformin, such as its efficacy, its possible side effects, and its contraindications. Our second objective is to uncover and examine the distinct correspondence and or difference.
Studies have proven that the insulin plant lowers the blood glucose levels of diabetic rats. Extracts of the plant were collected and induced to diabetic rats to prove its anti-diabetic effect. A study in 2010 by Vishnu et al. Claims that extracts of the plant increases the body weight of diabetic rats and decreases their blood glucose levels. In comparison to the effect on humans, Hegde et al. In 2014 states that diabetics who consumed the leaves of this plant reported fall in their blood glucose levels. Some chew the leaves itself to extract the juice for the reason that plasma glucose is lowered due to the potentiation of insulin from B cells, which helps in diabetic complications. On the other hand, according to Noto et al. In 2012, metformin is the drug of first choice when it comes to type 2 diabetes. It is characterized by the best available combination of efficacy, safety, and tolerability. The versatility of the drug is also monitored as it showed promising effects in controlling the development of cardiovascular diseases related with type 1 diabetes. When it comes to a safety profile in a budget-friendly way of treatment for cancer and diabetes, metformin is necessary.
Now, for the mode of action of metformin. The degree and rate at which metformin is absorbed by the body is approximately 50% through the upper small intestine. It is then delivered to the liver, where its main effect is the suppression of hepatic gluconeogenesis. And although the exact molecular mode of action of metformin is still debatable, a general agreement has been made that the primary site of metformin's action is the liver. However, Recent studies suggest that metformin's effects rather resides more in the human gut, and that instead of only one pathway leading to its hypoglycemic property, it triggers multiple mechanisms in the body. So,
On the other hand, insulin plant works almost in the same way as metformin, for it also intervenes with the body as it enters fasting state and postprandial glucose levels. The hypoglycemic action of the plant may be due to the release of insulin in the bloodstream. Glucose transporter 4, also known as GLUT4, is on the membrane of intracellular vesicles, unable to transport glucose. Release of insulin in the bloodstream result in binding of insulin to insulin receptors, which leads to rapidly to fusion of those vesicles with the plasma membrane and insertion of GLUT4 onto the plasma membrane, thus allowing glucose uptake into the cell. Also, insulin increases fatty acid synthesis in the liver. When the liver is saturated with glycogen, glucose is diverted into synthesis of fatty acids and lipoproteins. Insulin inhibits triglyceride.
Moving on to the chemical components of the insulin plant, studies were conducted to identify the active chemical components of the plant that is responsible for its pharmaceutical properties. Now, studies showed that through ethanol extraction, tannins, phlobatenin, flavonoids, saponins, terpenoids, and cardiac glycosides were found in the plant. Now, the flavonoids and sapogenins are responsible for its anti-diabetic property. Now, it is also found that this plant has antioxidant properties since it contains protein, iron, ascorbic acid, flavonoids, terpenoids, alpha-tocopherol, beta-carotene, and steroids. Now, for the methanol extraction, it showed that it contains carbohydrates, triterpenoids, protein, alkaloids, tannins, saponin, and flavonoids. The reason of the contribution of metformin in developing lactic acidosis is still impossible to determine. The said symptom also indicates a poor prognosis for type 2 diabetic patients. The possibility of a diabetic patient to have lactic acidosis is high if they have other sickness like kidney failure or heart disease. References regarding the nature and properties of the insulin plant reveals that it has no adverse effects.
Moving on to the pharmacological activities of insulin plant and metformin. Both medications are observed to possess anti-cancer effects. The leaf extracts of insulin plant was found to have anti-proliferative and anti-cancer potential in vitro mammalian fibrosarcoma, a type of cancer in the connective tissue, and its bark has potent properties of anti-cancer against colon cancer. Metformin has also a strong anti-proliferative effects on cancer cells. Their anti-cancer properties are linked to its antioxidant properties and not their anti-diabetic properties. Activation of AMP, activated protein kinase, and blockage of P13K signaling pathway in cell growth are the actions that happen that makes them anti-cancer. As time passes by, microorganisms will develop a resistance to anti-diabetic medicines. To reverse the effects in evolving microorganisms is to treat using medications with antimicrobial properties. Metformin has exhibited antimicrobial activity, with it having inhibitory actions against gram-negative and gram-positive bacteria, and also has antifungal properties. Insulin plant has also demonstrated antimicrobial effects. The leaf extract showed that it has high activity against Bacillus subtilis and Candida parapsilosis at low dosage at an agar disk.